GYN Path Review Part 1. Feel free to pause the video to give yourself time to answer the questions. What types of HPV are associated with condyloma acuminatum? HPV types 6 and 11. How to differentiate condyloma acuminatum from verruca vulgaris? Verruca vulgaris is a non-genital HPV-associated lesion that can be found on the skin or in the oral cavity. They are usually associated with HPV types 2 and 4. Verruca vulgaris is contagious and is often found in children. Condyloma acuminatum is the typical genital warts, and remember that it is usually associated with HPV types 6 and 11. What is the main characteristic of Arias-Stella reaction? Enlargement of the nucleus to at least double the size of a normal endometrial gland nucleus. The diagnosis of Arias-Stella reaction should not be made without nuclear enlargement. Does increased mitotic activity differentiate Arias-Stella reaction from clear cell carcinoma of the endometrium? It is important to be able to differentiate Arias-Stella reaction from clear cell carcinoma of the endometrium, since Arias-Stella is a benign change in the endometrium that is hormonally induced by progesterone. Mitotic activity is most commonly observed in the early secretory pattern of the Arias-Stella reaction. The presence of mitotic features alone is insufficient to differentiate Arias-Stella from clear cell carcinoma of the endometrium. What is the most common HPV associated with endocervical adenocarcinoma in situ? HPV 16 is the most common HPV type in endocervical adenocarcinoma in situ. Please note that even though HPV 16 is the most common type of HPV in endocervical adenocarcinoma in situ, HPV 18 is more often associated with endocervical adenocarcinoma in situ compared to squamous intraepithelial lesions. What is the most common malignancy to arise in immature cystic teratoma? Squamous cell carcinoma. Squamous cell carcinoma arising from immature cystic teratoma is difficult to diagnose preoperatively and has a poor prognosis. What is the immunoprofile of primary vulvar Paget disease? Positive of cytokeratin 7 and gross cystic disease fluid protein 15. How do you differentiate primary from secondary vulvar Paget disease by immunohistochemistry? Secondary vulvar Paget disease usually due to urothelial carcinoma, anal or rectal carcinoma. Primary vulvar Paget disease is positive for cytokeratin 7 and gross cystic disease fluid protein 15, but is uncommonly positive for cytokeratin 20. This is in contrast to secondary vulvar Paget disease, which is positive for cytokeratin 20, but is negative for cytokeratin 7 and gross cystic disease fluid protein 15. What percentage of Sertoli cell tumors are functional? Sertoli cell tumors are functional in approximately 40 to 60% of cases. Most cases are due to estrogen excess, but some can be due to androgen excess. Rare cases may show a combination of androgen and estrogen excess. Sertoli cell tumors are commonly unilateral and are yellow on gross inspection. In what ovarian lesion are Schiller-Duval bodies seen in? Schiller-Duval bodies are seen in yolk sac tumors and are characterized by a central vessel surrounded by primitive germ cells. In what ovarian tumor are Call-Exner bodies seen in? Granulosa cell tumors. I hope you enjoyed this video. To get updates when similar videos become available, please consider liking and subscribing.